Good afternoon. Anyone who is watching this meeting, it's on, okay, on Google, I'm sorry, on, the meeting is broadcast on YouTube. We're having some problems with Zoom. So if you would go to Central Health on YouTube, you will be able to watch the meeting in completeness. All right, good afternoon. Today is May the 10th, 2023, and it is 1:05 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of our committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first item of business is public communications. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments for the Strategic Planning Committee meeting? We still seem to be having some audio.
We do not have anyone signed up to make public comment.
Thank you so much, Ascension. No one is signed up. We will now proceed to the committee agenda.
I'm going to do a quick rundown.
I'm going to jump back on.
Numbers in this report. In 2022, Central Health served more than 152 patients. This includes all of our enrollees in our various programs, MAP, Basic, Presiding fee scale, as well as all the community care patients and our Chavez enrollees. It represents a 5,200 increase of the previous year, about 4%.
5,000 primary care visits, which was an increase of 33,000 over the previous year. We enrolled 51,000 people in MAP, which is also an increase of 3,700 or 8%. 6,800 were enrolled in our MAP Basic program, which was a pretty significant 8,000 or 13% increase over the previous year. We received more than 23,000 online applications to enroll in our MAP and MAP Basic programs. This is consistent with the previous year and represents a 45% increase since 2020, since we implemented new and improved ways for people to enroll in our programs. We now have 228 provider locations. This includes 24 new locations added in 2022, which is a 12% increase over the previous year. So just a few highlights. Our patients enrollment and visits are now exceeding the pre-pandemic levels. So while we saw an expected dip in the previous 2 years, we are now serving people at levels higher than before. The equity in 2022, we developed and adopted our equity-focused service delivery strategic plan. You may know as the Healthcare Equity Plan. This involved the development of a safety net community health needs assessment, a voice of the community study, and a capabilities and gap assessment. We funded capital improvements and launched capital improvements. This includes wellness centers in Del Valley and Hornsby Bend, as well as our Rosewood Zaragoza multi-specialty clinic in East Austin. As we mentioned earlier, we launched our direct provision of healthcare, beginning with podiatry. And we expanded our substance use disorder treatment. This includes expanding our MAP programs, medication-assisted therapy, as well as partnering with new methadone treatment facilities. And finally, we launched a new medical respite program, which we all know is providing post-acute care, particularly for our homeless population, to help decrease readmissions. And that is the highlights. I hope you enjoy the report. And as I said, we will we have plenty of copies out in the front. We will be distributing to staff and as many people as possible.
Well, thank you so much. That was very interesting, and we will look at this closely.
Thank you.
Anyone have any questions though? No? Oh, one question. Doctor.
We're good now.
Yes, we will work with our communications team to make sure it is. Yes.
Thank you. Any other questions? Oh, Manager Johnson.
I have a newer picture.
I will get a hold of that.
Yes, yes.
Staff member may answer, but what was particularly notable, and I'm sure we've covered this data point before, was the increase in online applications submitted by means of, I guess, making that more accessible or more ways to submit applications. Did you say something like, what was the percentage increase?
Year over year is pretty consistent, but since 2020 is about 45%.
45%. Where would we go, or how would we go about getting to learn more about applications versus approvals year over year? I mean, I don't expect you to have that in your pocket,
Yeah.
right? Or you necessarily have it immediately in your pocket.
I would probably.
Thank you. The question was around the applications submitted, which I think from between now and 2020, there's been a 40% increase in applications. The question was around how we might learn more around approvals versus applications in that time.
Sure, I would want to defer to our to Kit, our
Okay.
VP in charge of eligibility.
Super. I'm guessing Kit's not.
Yeah, let's see.
I'll follow up and just ask about it later. Thanks.
We'll make note of it and bring it back.
Thank you.
If there are no other questions, we will move on. So thank you so much.
Thank you.
No motion is necessary for item number 2. And I announce that the committee is now convening in closed session. No. Oh, I'm sorry. Number 3. Okay. Number 3, receive and discuss updates on the 1115 Medicaid Waiver, the Community Care Collaborative, and other healthcare delivery partners, programs, projects, reporting, and arrangements, including agreements with Ascension Texas and the University of Texas at Austin. Mike Giesland and Monica Crowley will be presenting.
Yes, thank you, members. What we wanted to do today, and you've seen this reporting matrix that's in your packet before. We talked about it back in January, but we want to keep bringing it back as we head into budget season. You understand what it is and the type of information that you'll be receiving, and that's going to be critical to your role as board of managers. It's year round, but especially with budget season as you all are making decisions. So what we'll do today is, and I want to thank Monica for helping us get ready for this, is we'll walk through, we're not going to go through line by line by line by line and analyze the report, but what we're going to do is give you a overview and some baseline working knowledge in anticipation of UT actually presenting to the Board of Managers in the future so that you got the necessary knowledge to not only follow the report, but also to engage in that discussion with UT and ask the pertinent questions that need to be asked. So the matrix that you have in your packet, it stems from direction given by the Board of Managers in September of last year via the budget resolution. And since that time, in addition to having input from the Board of Managers under the guidance of the board chair, representatives from Central Health, Dell Medical School, and UT Austin, meaning the leadership at University of Texas at Austin, have been engaged in this and working on an agreed structure that you see in this packet, which is the reporting matrix. Now, the goal is to ultimately show, how the work that UT is doing meets its obligations under the affiliation agreement, and directly and indirectly benefits the safety net population, because there are direct things that you can look at and say, yes, this has that benefit, or there are indirect benefits, but either way, we want you and the public and everybody else to have transparency into what that looks like. Another goal is to demonstrate how the dollars that have been spent by UT Del Med School are in alignment with the mission of Central Health, and that's one of the fundamental questions that needs to be asked frequently, and we need to be able to answer that. So real quickly, there are over 20 lines in the reporting matrix, and what we'll do today is highlight a few that center on Section 4. And Section 4 of the affiliation agreement spells out a lot of obligations for the University of Texas, and so I'll highlight a few of those today. And Monica, please, if there's something that you want to chime in on, I've got my peripheral vision going in two different directions. Please sound out, and Madam Chair, would you please recognize Monica to say something if I don't catch it. So to understand, again, Section 4, that sets forth obligations for the University of Texas, and I'm going to touch on a few of what you see in this reporting matrix, specifically 4.1, 4.2, 4.3, and 4.9. Sections 4.1 and 4.2, we'll be receiving detailed information about students and residents, including demographic breakdowns, what schools they came from, and what residency programs they're entering. And this is important, if we were in your shoes, to understanding, what's the pipeline of providers that are coming in to serve the community that we serve. And so up to this point, you've been receiving counts and some information about residencies, but we want to drill down even further. I think Manager Jones, you had posed similar questions before about understanding, how the pipeline of providers that is being created to serve our community, what that looks like. Still sticking within Section 4, but looping in 4.3 and 4.9, looking at the residency totals, but also what the rotations are, including what sites that the residences rotate through on primary care and medical student clerkship. And this is important because it shows what care and where that is being provided by residents and through student clinical training. And it really helps you understand what that effect is on the central health patient population. Sections 4 and STEM, again, still within Section 4, but back to 4.2 and 4.3. It will have an allocation matrix for employed faculty that demonstrate the numbers of faculty working in the different locations. So up to this point, we've been referencing medical clerkships, residencies, and so forth. Now we're focused on the faculty, which are a critical part of the safety net system that is funded through the $35 million that shows what locations where they're working. And then the health equity curriculum. Now, this is not something that is specifically funded by Central Health dollars as part of the affiliation agreement or prior CCC dollars, but it is an obligation that they have under the affiliation agreement, and it shows the benefit to the safety net population that's being developed by the medical school through its health equity and its active research. And I know enough to say as much, but I think this is something that UT is going to need to come back and articulate at a level that satisfies the questions that you might have. Now, what is still underway, and I want to give staff kudos for working with UT on this, and that's the financial reporting. So this is something that I think gets to the crux of the matter, in addition to the aforementioned, which shows what's the value for the $35 million overall, and tries to quantify that in as much as possible, because there is a multiplier effect that you get with the $35 million being an enabler. But we need to work towards, and it's going to be iterative. I mean, as we evolve in this relationship, but each opportunity that we have to bring more specificity to that, we want to do that. So they're currently working on the financial piece that's contemplated on the reporting matrix, and we should see that early September, and realizing that you have a vote that you need to take. That is a critical path item in advance of the budget and the tax rate vote that we want you all to have. So with that, I'll pause. Monica, did I miss anything, or is there anything else that you would like to add?
I think the only thing that I would like to add is I know that you guys have static copies of the matrix in front of you. The static copies are less useful than actually looking at it. Thank you. Sorry. It's, the information that Mr. Giesland was discussing is available through active hyperlinks that are, that live within the electric version of the matrix. So, referring to section, the combined residency grids, showing the locations and number of, the rotations of the residents that Mr. Giesland mentioned as it relates to section 4.1 of the affiliation agreement, section 4.3 and 4.9 of the affiliation agreement. If you click on the hyperlink related to those sections, then it will take you to an active box link that shows what are called rotational grids with a block diagram with a key that shows the key for what site is being referred to, and the rotation name, the percent that's outpatient, and then where these rotations are taking place. Now, I can say all of that. To me, a lot of this is like, turning on my car. I get in my car, I can drive my car. If I turn on my car and my car doesn't work, I've got to go to somebody else to explain what's really going on under the hood. And so I think, as Mr. Giesland said, having the folks from the University of Texas, they have explained to us, to Dr. Shalsha and John Morgan and me, how this is meaningful. It is meaningful information. I don't have the capacity to explain exactly what it means and how it is meaningful.
Thank you.
So, but it does bear, even that being said, it bears looking at. So I would just encourage all of you to look at the electronic version of the matrix and click through to the hyperlinks. One of the things that that is understandable, even to a layperson, is the section about the active research projects and what the subject matter of those research projects are and where they're being conducted, and how those projects, quality improvement or other, within community care, People's Community Clinic and Lone Star Circle of Care, are directly benefiting the populations that we work with.
Thank you. So, Madam Chair, to close out the staff presentation portion of this, just in terms of what's next, this reporting matrix will be in addition to any other annual reporting that DelMed also provides. There's a lot of qualitative data around the different programs and activities, and so this is additive to what the board has typically received. And then the first presentation right now is with the medical school reporting to the board is tentatively scheduled for July. And then, of course, in September, and then we'll come back to the chairs of the board of respective committees to say, is there any other conversations that we need to have and make sure that gets on the agenda as well. But plan on July and then again in September. Thank you.
Online matrices, they be kept up to date. Who is doing that update? Is it us or is it the university?
Oh, it's the university. Yes, absolutely.
First of all, thank you guys. I appreciate this walkthrough. I've actually clicked on some of the links and they're actually quite informative. So I would definitely recommend for the rest of the board members to look at the online version and actually click on the links. It does bring you to some interesting information. And if I'm to understand correctly, in July or around July, the medical school will be coming to give their annual report to us with regarding the $35 million investment that we actually place into the medical school. And the matrix will inform that presentation. And there will be additional information of a more qualitative measure provided by the medical school, meaning that they come and sort of tell us a little bit about the quality of the services that they're providing, et cetera, et cetera. I missed out on the accounting part. I know we're working on that. Do we expect that to be ready by the July timeframe, or is that going to be something that is going to happen a little later? Just a question.
So my understanding is September.
Okay.
Is that correct?
Yes.
Okay.
Yeah, but again, realizing you all have a vote to take, September would be an imperative that information be brought to you by that time.
Got it.
We understand and emphasize that importance with UT.
Got it. Just wanted to make sure that the members are informed.
Thank you.
Thank you. Any other questions? Yes, Manager Kitchen.
So the matrix has been agreed to by Dell. Is that right?
Yes.
The structure has, yes. We're still working through them in terms of what comes in underneath the structure.
So the particular data points may or may not have been agreed to.
I think that's fair to say.
Okay. Is the thinking that this matrix will be attached to the contract once it's completed? In other words, here's my bigger picture. My bigger picture question is, how will we be enforcing the matrix? Or what's our authority to enforce it? That might be a better way to ask it.
That is a good question. I would need to confer with legal counsel, both Monica as well as outside counsel, to really answer that question as to how this could be incorporated. But in coming up with this matrix, Manager Kitchen, if I may, it follows the affiliation agreement.
Yeah.
And the affiliation agreement contemplates reporting. Mm-hmm. And so in terms of the mechanism is being able to have the necessary reporting, it goes hand in hand as it stands right now. Now, being a recognized schedule or an attachment, no, it is not. But that's where we would need to consult with legal counsel about how we would do that if that's the desire of the board to go that direction.
Yeah, I'd like to know, I don't know what the best mechanism is to do that, but I would like to know how to memorialize this in such a way that it's expected in the future and it's part of their legal obligation.
Understood.
So
Good question, yeah. So we will come back to you on that aspect of this.
May I ask? Yes. And then I think I understood what you were asking, that it's in September that we would expect to see the accounting back to the $35 million. Is that what you're asking? Okay.
That's correct.
And so that's before our budget, is that right? We'll receive it before we vote on the budget?
Yes, I think you'll get, and I'm getting out a little bit ahead of this process, so full disclosure, members, please.
Sure.
But I think in July, you will start to see some level of a good level of qualitative data about, okay, this is what the med school is doing as a result of the funds that it has.
Okay.
As far as the financial reporting piece, and I'm just saying you'll get some glimpse in July.
Okay.
But what's the hard numbers piece, I guess is the way that I characterize it.
Okay. For myself, will be interested in seeing that accounting, I guess, if that's the right term, back to the $35 million in order to be able to vote on the budget. I will also want to see that this this data reporting is captured in some kind of way that it becomes binding. So that's the other thing I'd be interested in seeing.
If I may, and I don't know if this is set for, this is receive and discuss. We can bring this back to the executive committee to set as a future agenda item, but I think to memorialize what Manager Kitchen has said would be an important step for this body to take. And whether that's through this committee as a recommendation up to the full board or just take it to the full board, but something that I think that memorializes this would go a long way.
Okay.
I also think that there might bear a closed session discussion in which we look at mechanisms in the current agreement
Okay.
that allow for around Central Health's guarantor obligation of the $35 million payment as we're teeing up this kind of board conversation as well. And I think that would be valuable.
Okay.
Yes, Manager Bell.
And I would also add to that for everyone, as a refresher, and those that are new to the board, that we have a summary of what the agreement actually requires. And I think that's going to be important for everyone to understand, because when you get an accounting of the monies, that accounting is going to be associated with the agreement that we have to UT. And so we do need to understand from a high level, it's not something that we need to go into line by line detail about, but from a high level, exactly what that agreement requires. Okay? Mm-hmm. And that would be a closed session item, I think.
Yes, Manager Matwani.
Sorry, Manager Jones.
I'm sorry, Manager Patrick. Oh, my bad son.
You're gonna talk about your picture this time, that's why I'm going. Just wanted to clarify if Manager Kitchen was, when discussing, asking about the accounting, were you wanting to make sure that every expense associated, every expense in that 35 million that is aligned with the revenue source from Central Health at the med school be accounted for? Basically, we get an accounting detail or a ledger detail of everyone, or at least a categorized ledger detail of all of the expenses associated with this revenue source, right? Like we've seen maybe before, but are you suggesting that happens annually?
I think that annually we need an accounting.
Mm-hmm.
Now, what exactly the accounting looks like is I'm open to discussion on, but I want to be able to see that the $35 million has been spent in such a way that relates to what their requirements are. So, and I think that as a board, I'd like to have a discussion about whether we think that has happened. And also, my expectation is that the data in the matrix gives us the information to be able to be assured that that's happening. And that's one reason I wanted to make sure that the data in the matrix is required and carries forward. So we're not having every year to want to ask for data and not knowing if we're going to get it. And also, it feels to me that the data should be expected up front before the dollar amount is approved. So that's what I'm thinking.
And I would say it is intended that, and so I absolutely agree with you. And of course, we don't want to agree to something with the current UT staff that then, if they leave, we have to kind of renegotiate this entirely again. So that is a fantastic point. Thank you. It is the intent of the UT staff that we worked with and UT Austin Tower staff and the UT Del Med staff that this information in the matrix would be presented by August. The part of it that we're still, kind of working on is what will be sufficient beyond just the financial agreed upon procedures that, they've already agreed that they will complete for this year, but what is that more detailed level of financial reporting that will be sufficient for the board to conduct its oversight obligations.
Yes.
But it would be August, so for this year, since we're still trying to come to agreement on that piece, is that the piece beyond the agreed upon procedures is this piece that Mr. Giesland was saying may
And beyond the
come
departmental
in
funding, because
September.
that's in the past,
Yes.
I'm sorry,
Yeah.
but in the past, that's typically that's what you've seen is a departmental breakdown. And so it's having additional breakdowns that answer the questions that is being posed here by many of you today.
So, or maybe, so am I hearing correctly that we're thinking in terms of nailing down these matrix data points before we vote on the budget?
Yes.
Okay.
And if I don't, then I'll need to report as much to the board.
Well, this is something to let the medical school know that that's our expectation.
Understood.
I was just going to respond, Chair, that I get the sense that at least glimpses of accounting as I might have seen them in the past, and forgive the blur of millions of pages of backup that we've read, seem to be, maybe rolled up at high-level expense categories, whether it be department or personnel or what have you, that aren't necessarily in a flat report compelling, and I feel they may be even less so compelling when you get into the granular sort of ledger detail or transactional detail. And so my guess is that this matrix, and I think this is maybe just regurgitating what we're saying, is going to become extremely important to add some dimension to qualify, I think, those expenses, and hopefully also be an orienting mechanism for us as we move forward to continue to move in the direction that we feel is consistent with the spirit of the agreement. So I think it's super important to have both of these things sort of attached as contractual mechanisms for orientation going forward.
And if I hear you correctly, Manager Montwani, you're talking about written at a level of detail that we know the data elements we're getting? Is that what you're saying?
Well, yeah, maybe. I guess what I'm suggesting is that I'm not bullish on an accounting report being super compelling, and so no matter at what level of detail that we get.
Okay.
But I am definitely encouraged by the kinds of things we see in the matrix, and I think our ability to interplay those two is going to be extremely important as we aspirationally move closer and closer to the spirit, our shared understanding of the spirit of the agreement.
Manager Jones.
Okay, thanks very much. This conversation we're having here today makes me understand, I'm not sure we're all on the same page with regards to our support for this effort. And I say that because, one, not being a member at the initial conception of this agreement, but even having voted to support it over the time frame, I think it raises the question that we as a board need to make sure we're sure of what it is we want from UT. It's been my experience with bureaucracies that once you start putting out a lot of data, a lot of data points, people get fuzzy. Not only board members, but also the citizens of the public as well. So I guess what I'm asking is it possible between now and next time, we have more of a somewhat simplistic outline of the data, excuse me, either through the links or through some other mechanism. So one, we're clear on what it is we're asking and what those numbers will look like or should look like. But also for the general public, because I don't think that the public for which we're representing clearly understand all those expectations. I don't think they need to know to the granular level, but they certainly need to know, I think Chair Bell had said earlier, have the picture of what the expectation is, of the big picture. The last thing I did want to ask is that we're talking about timeframes. So our budget, we're going to be voting for our budget in September, is that right? So we're going to be up against a very difficult deadline if we don't have information available to make a budget. Not to make an analogy, but at the national level, we're seeing what's going on with the debt debate. I'm not so sure that if we come down towards here, at least I can't speak for my colleagues, if I could be able to support going forth if I'm not clear on those activities. So I just put a little urgency in terms of, one, getting it, making sure it's clear enough for us to understand and translate to the community, and then we get it timely enough so that we can get make an adequate vote in favor or not in favor of it at budget time. Those are my comments.
Thank you, Manager Jones. Any other comments? Yes, Manager Martin.
Thank you. I guess this is part of just an educational process. So this $35 million is our budget that we will give to UT. And if I'm thinking it correctly, they have to sort of prove that they're going to spend that money, or is this just a pot of money that they have to find a way to spend? I mean, what if they come back, I need more money, or I really haven't found a way to spend the money, or I'm sure they will find a way to spend the money. But how does that, I guess it's vague to me, sort of, they're going to show us a budget, but suppose the budget that they show us for the services provided are higher or lower. How does that proceed?
Right.
Are there constraints?
So, in a very general and high level, is the $35 million is a portion of their overall budget. And so what they've done in the past is they've shown, here's the departmental breakdown, and here's the percentage of the $35 million that is allocated to this departmental breakdown as part of the overall budget. And off the top of my head, I can't remember what the total budget is. What I do remember is the last time we looked, last year's report, it was somewhere in the neighborhood of 12%. The $35 million was 12% of their overall available resources, plus or minus. But so the point made earlier, they come in and they report on the recent activities, if you will. This is what we've done since we last talked to you. But then going forward, this is the level of detail that you will be able to see financially and be able to make the links to how is this consistent with Central Health's mission. And that's a very broad level. Now it starts getting down to more and more detail as you get through this reporting matrix. And I think to the point earlier, Manager Jones, yes, they will need to come back and compile this, but this, that will be what UT needs to do because they're the ones that have the data and they're the ones that are doing the work. And so I want to pause there because I want to make sure I'm answering your question because I've talked about the allocations, what it is that they have to demonstrate. Was there anything else that I missed in your question?
Well, there's just this pot of money that needs to get spent somehow. And I'm just curious if the system is designed in a way to sort of just for them to find ways to spend the money versus us truly having oversight in more detailed ways to...
Good question. Yeah, I understand now. Yeah, so there are permitted investments that are outlined in the affiliation agreement. And that sets up the metes and bounds by which they are held in terms of what they invest funds in. Now, as part of this is really the evolution of the partnership, if you will. With the global pandemic interrupting a lot of this evolutionary process. And so as the med school has grown and come out of its maturing phase, if you will, and is bringing more and more capacity, which our patients are benefiting from today. And I know that there's co-recruiting going on for specialty care, so there's a lot of things that they're doing to help us with our safety net population. But we can't miss this opportunity in our evolutionary process to first of all, play a little bit of catch-up based on what happened during the pandemic interruptions, but also to recognize that both of us are more mature than what we were a few years ago. So the sophistication in the reporting and the accountability needs to grow as well. And that's ultimately what we're trying to get to. So it is an iterative process that's measured over a time frame, but we try to show progress each year in terms of where we're going.
Manager Benson and Manager Martin. So I agree. These are really important questions, and I think so. One, I do think if we are going to really go into detail into the obligations of the agreement and like we were talking about before, enforcement of those obligations, that is closed session item for some up and coming meeting. Although we have said many times, so this isn't closed session, that under the agreement section 4, which this matrix is based upon, is a section in the agreement that spells out the obligations of the University of Texas and the Dell Medical School to Central Health. And so one of the ways that in addition to demonstrating that the $35 million is being spent pursuant to the permitted investments that are allowable, there are also, as Mr. Giesland was saying, as the medical school has matured over time, there are the obligations under Section 4 of the agreement that it's part of the Central Health Board of Managers' oversight to determine are all of these obligations being met. So it's not necessarily just about how is the $35 million a year being spent. It's, is that being spent pursuant to the permitted investments and consistent with the mission of Central Health? And is the University of Texas meeting all of the obligations under Section 4 of the agreement? So there's this kind of, I think, two-part oversight that you guys have as board members.
So it's $35 million, this number got pulled out, and how does that number move over the years? If they're going to say we're providing increased care, or I guess where does that number stop for us? Say we need more money, they proved that. Does the board have the ability to allocate more money if needed?
So you guys already have, that's part of the joint affiliation committee. As there are, new lines of services and services that are being provided over and above what, was contemplated under the original affiliation agreement, then that's something that is determined as part of the annual budget process. And then periodically, we bring agreements to the board, like the master services agreement that the board contemplates and can take action on.
Manager Martin, if I may, that $35 million is constant. And so there's not an inflator, I don't believe, that gets applied to that. And so all of any additional amounts are purely at the discretion of the board.
Okay. Thank you.
Yes, Manager Bell.
And I just want to say, Manager Martin, that in my conversations with the dean, they have played, their expenditures are steady for that $35 million. It's utilized to support the infrastructure of the medical school. And so they're not looking for places to spend it. They have places to spend it, and if they don't receive it, they're going to have to do something different and find other monies to be able to support the medical school if that money's not there.
Thank you, Manager Dahl. But the expenditures they're allocating are strictly related to Central Health's needs.
The expenditures that they're allocating is strictly related to the permitted investments of the agreement.
Thank you.
Okay.
Thank you very much, Manager Kitchen.
One quick question related to the, one of the line items. It says the annual report, including services, volumes, and outcomes for MAP and MAP patients. It sounds like, is this the same report that they have provided for every year?
Manager Kitchen, could I trouble you for a PDF page that you're reading from?
Oh, it's a 125, I think.
Thank you.
It's
Allow me
next to
just a moment.
4.2.2, and it just says annual report, including services, volumes, and outcomes for MAP and MAP basic patients, and then the notes are annually provided this data and have for the 4 years.
Yes, and that's the annual report previously mentioned, where whatever we receive under the reporting matrix is going to be additive to the annual report that they receive. And that's, I'm sorry. Go ahead.
Okay, so so my question then is, this annual report that we have been receiving, does it have we asked for any additional level of details around the services, volumes, and outcomes for our MAP patients?
Well, so there's two things, and I'm going to start off answering this, and I'll ask other staff to chime in. So short answer is yes, we have. And that's also part of the process that we're working on now that we mentioned earlier about the financial reporting. As the partnerships evolve, we need more detail. So there's a higher level of scrutiny. The other thing that I want to point out, which is the obvious, this vote that's coming up is the first time that the Central Health Board will need to vote on the full $35 million.
Okay.
Because up to this point, it's been covered fund balances through the Community Care Collaborative, and in this fiscal year, we have $22 million budgeted, so this will be the first vote. So hence, there's a compelling change coming that's necessitating this level of reporting, in addition to the two entities maturing. What you received, or what the board has received, and it's public, it's out there for anybody to view, is the financial reports up to this point have been departmental breakdowns. And
they're not outcomes for MAP patients?
Well, it has departmental breakdowns in terms of the allocation of $35 million, but yes, they have breakouts for patients served overall, as well as by line of service. And then those are subsequently, then those are broken down into what percent were MAP and Medicaid, and I believe Medicare. And so, now that's one piece. The other, in
But
Roman number one.
Is there outcome data?
Is there outcome data?
Well, I can dig into this later.
In terms of health outcomes?
If you're not clear right now, that's okay. I can dig into it later. I'm just wondering.
I'm just thinking back to past reports. There's been some anecdotal, Manager Kitchen, but it is not, for example, a comprehensive set of outcome data like what you see on some of the service delivery reports that we provide to you all, or the demographic report. The other thing that I want to point out is that as we stand up agreements for additional clinical services, there is a level of claim level type data that comes in that shows patients served, and I'm going to turn over my right shoulder, if you'll permit me, to see on the claims level data if it also addresses outcomes.
There's reporting that comes with the claims data for the master services agreement. There's additional reporting that does include.
Come over.
Thank you, John.
Say it also that's for women's health and musculoskeletal already.
Yes, so for the services through the master services agreement, or the agreement prior to that covered musculoskeletal services and women's health services, there's additional reporting that covers outcomes that comes in addition to the actual claims data that we use for transaction purposes.
I'm sorry.
And the medical school presents that data to us every year for those services. In the MSA, there will be similar reports on clinical outcomes and patient-reported outcomes for each of those different service areas.
Okay, thank you.
Thank you.
Well, I have a question now. I have sort of a detailed question. So with the report last year, I don't remember them reporting out Medicaid, Medicare, and MAP separately. Did they report that so that we could see each, or did they report it all together?
the report was split. I believe this was in the second portion of the report, and please don't hold me to that. I shouldn't be going off a real memory like this. My apologies, Chair. But there were some slides that were presented that showed those unique patient counts and then what percentage were MAP and Medicaid, Medicare.
Okay, thank you.
Those are the form of PowerPoint slide.
Yes, yeah, thank you. Any other questions? Manager Jones?
Yeah, I just want to reemphasize what I said earlier, in the sense that I think that we're getting the picture of what we're asking, but I think, I'm not sure if the public knows, and I'm constantly being bombarded about the $35 million. So to the degree that we can make it clear, frequent, and unobtrusive, I think it would be helpful. I'm looking through our annual report here that we were just given, and the question is there anywhere in here, I'm just looking through it, that we even allude to the fact that Dell Medical School is being funded, or that their service delivery is impacting what we're doing here? So I'm just wanting to emphasize that as transparent as we can be with utilizing, letting the public know that those dollars are benefiting them as well, in whatever mechanism this or whatever. I think that I want to just re-emphasize. It may be here, I haven't had a chance to look through it, but I just think this was a good mechanism as well as other mechanisms that we might want to look at to get the message across to the public.
Yes, sir. No, understood, and that's, part of the reason why we have kept this reporting matrix in the packet while we're coming back and talking to you again, to bring that level of transparency to the dialogue that the board is going to be having. And we absolutely agree and concur. And, and I think two important milestones, if I were in your shoes, where I think we need to be proactive in terms of how we talk about this, to be able to answer the questions. What of the $35 million? Again, are going to be those July and September discussions. But I think there's going to be a lot of opportunities there to tell a good story, if you will. So the other thing I was looking for is that I want to point out about the actual funding. Recall that every time that we bring a community care collaborative report to you, and this year, a central health report, you can see the line items in there for the UT funding. And then once that payment is made, then it's recorded as an expense in those monthly financial reports. The way auditors classify it's in here, but it's not spelled out explicitly, but obviously it's captured in the audit report too as well. It's just auditors classify things differently when they put together an audit report. But to your point, I think future versions of this we need to call out. But I would also say, in light of the timing of this report and the timing of the reporting from the med school, it would have been difficult this year to get that information in this report. I do think in subsequent years there's certainly an opportunity to be able to do that.
Sorry, this is somewhat educational once again for me. So say a Medicaid patient of ours goes to the clinic and is seen by Seton UT faculty physician, and a claim is submitted. Who is that claim paid to? To the UT faculty? And because I'm saying if we're just handling the expense column, but they're receiving the funds for that, is that balanced out in the final accounting as terms of recovery for expenditures?
Could you ask your question one more time, sir?
If say a Medicaid patient of ours goes to the clinic and is seen and a claim is submitted, who receives that check for the payment of service?
So I think it's going to depend on the location where those UT faculty or residents are providing care. So the medical school and the UT faculty are a pretty integrated component of care being delivered at community care, for example, at Ascension, in their facilities over at the medical school, so their clinics. So whichever environment they're providing care in is going to receive the reimbursement from a Medicaid perspective. To answer your question, if you meant MAP,
I think, again, it's going to depend on which contracted entity, which partner location we're talking about, and the reimbursement arrangements that are specific to that environment. So if it's under our MSA, Master Services Agreement with UT, and UT provides a musculoskeletal clinic service to one of our MAP patients in their facility, we would reimburse UT for that cost, for that reimbursement, that service, through that Master Services Agreement. Does that answer your question?
And that's not, so those costs are not attributable to the $35 million.
Correct.
So they don't overlap, and when you look at the contracts that the hospital districts have with the academic health science centers, they're all different when it comes to that billing piece. So the contract that UHS has with UT San Antonio has a different kind of payment mechanism than the one that UT Southwestern has with Parkland, which is, I think, kind of what you're talking about. I think the one that UT Southwestern has with Parkland is UT Southwestern actually does the billing within Parkland, and then Parkland makes up the difference of what they're not compensated for. But all of the structures, including our affiliation agreement with UT, are contractually they're different.
Okay,
Yeah.
thank you.
So.
Thank you very much. Any other questions? No. All right. There's no motion necessary for this. Yes. All right. So now we will move on to number 4, receive and discuss a briefing regarding Travis County Healthcare District, DBA, Central Health versus Ascension Texas, FKA, Seton Healthcare Family, cause number D1GN230000398. And we will go into, the committee will go into convening in closed session to discuss this agenda under item number 4, Texas Government Code 551071, consultation with attorney. And it is, again, 2:15 in the afternoon on May the 10th.